My name is Nomita Ganguly, and I'm a Democratic candidate for state representative for the 24th Middlesex District, which covers all of Belmont, 6 precincts in Arlington, and 2 in Cambridge. I've lived in this district in Arlington for 7 years and then in Belmont for 18 years. When my children went through the public schools in Belmont, I thoroughly enjoyed my time working alongside parents, teachers, administrators, and staff at the schools to support our students and to create a community around the children. I was on the board of 2 PTOs and co-president of the Chenery PTO and then co-president of the Foundation for Belmont Education. Because of these experiences, I'm very committed to public schools and school funding. At the same time, I've been working as a legislative advocate on behalf of older adult nonprofits for the last 20 years. Before that, I worked at the State House on both the House and the Senate side. I think we're in a critical place right now with federal cuts that will result in people falling off of Medicaid and the ACA, and there are already people dropping off of the connector care because premiums are too high. This is terrible for the individuals and families, and it is also putting an enormous strain on our already burdened healthcare system. We are also seeing nutrition program cuts, resulting in individuals losing or receiving reduced SNAP and others unable to pay their grocery bills. We are seeing immigrants who are unprotected and vulnerable, older adults who can't afford the incredible cost to remain in their communities receiving services, and municipalities struggling with town and school funding. Our district needs a representative at the State House who has demonstrated a commitment to these issues and is willing to advocate hard to address these critical matters. I'm not new to the legislature. In fact, I've been around it longer than our current representative. My purpose as a legislative advocate has been to help nonprofits navigate the legislative and state budgetary process to achieve success and to ensure that underrepresented groups and vulnerable populations have a voice at the State House. I've worked with advocates to increase oversight and consumer protections for older adults in assisted living residences by helping them pass legislation to create a commission to study the assisted living industry. This bill was filed for a few sessions in a row and never made it through a first committee because of pressure from the industry. In the 2024 session, I worked with the state senator to add the commission bill through an amendment to a larger bill, and it became law. That commission worked all last year and produced a report with regulatory and legislative recommendations to protect assisted living consumers. I was pleased to see last weekend the Boston Globe did a story on the new regulations at the age agency. These regulations are a direct result of the commission's work and the bill being passed. Although the bill was stopped at the starting line for a number of years, we persisted, and the change will improve people's lives. I've also been fortunate to help pass a bill making sure veterans' benefits were counted appropriately so those veterans were not denied Medicaid coverage. And I've advocated on initiatives that make it easier for older adults to access community-based care. In advocating at the State House, I've seen how the House legislative process has become less and less transparent. It is hard for underrepresented voices to be heard or the public to have input into the process. Most of the budget and the legislative decisions are made behind closed doors, inaccessible to the public. The House recently passed a transparency bill to address the legislative audit that was approved by over 70% of the voters in 2024. This transparency bill, which scales back the scope of the audit, passed the House with the least transparency. It popped out of a committee with no public hearing, which is required of bills, no public opportunity for input, and was voted on 24 hours later, seemingly illustrating the lack of transparency in the House. Only 3 Democrats voted against this bill. We need new people who are not entrenched in this dynamic to change the culture in the House and address the issues that are critical to constituents, not those with money. We can only do this with new voices in the House and the courage to demand a change. We're in a critical time right now with the federal cuts, and we need to establish low-cost healthcare alternatives for people who are facing healthcare cuts, create a better network of affordable care for older adults, ensure local aid and school funding continues to increase to meet our community's needs, make sure we have a transportation system that makes us want to leave our cars at home and that is effective, efficient, and works on our schedules. I'm ready to work hard using my advocacy skills to advance pressing issues, represent the community that I'm so deeply invested in, and make the House a more equitable and accountable institution. I respectfully ask for your vote on September 1st.